Okay, so in this video we're going to go through a manual therapy technique for the hip to improve extension. So Glenn, how would we do this technique?
Well, Patrick's in this position prone on the couch. I'm going to bring him up into as much extension as is available for him. So if we assume that it's about there, you could just pop a towel under the knee if it's very limited, and from that position we're just going to do a PA. So I'm applying pressure.
Where in your hand are you applying that pressure, and what are you applying it onto?
Well, I've got my right hand stabilising his knee. That would also enable me to bring in more hip extension if necessary. And this is literally a posterior anterior pressure on the back of the hip joint. So I've got my fingers on the greater trochanter, so I know where I am, and the heel of my hand is pushing into the back of the hip joint. I have a anterior medial direction with the glide to try and align with the hip joint, and then as we feel that's loosening, we can bring in a little bit more. If Patrick's got a bit more hip extension, which I know that he has, I can bring my knee up and support it there as well.
And do you tend to do a grading system with this, or do you just tend to feel and try and just improve that motion of the hip, or how do you do it?
Yeah, I suppose if you're Maitland trained, you could have grades in your mind. I tend to just push into resistance, and use quite a large amplitude of movement as well. But going into resistance, I think, is the key there, because you're trying to improve mobility and range. I think I don't tend to. You have the grades in your mind, but I don't tend to be completely strict with it these days. I tend to just feel for the resistance. You're wanting to improve that range of movement, so you're wanting to get into that area of stiffness and actually reduce that stiffness. Again, whether what you're reducing, what we know is that what we're aiming to do is improve the extension. So if we're improving that extension, that's the main thing. And I don't tend to worry too much about those grades. What we'll also do now is we'll just do a quick close-up of that position, so you can really see exactly where the hands are when Glenn's doing that.